surgery doesn't support it. I think what you've displayed here, the bravery, the passion, and the unwavering dedication, I think gets you that. I think maybe we go. Thank you so much, Juba. So good to see you as always, sister, and just wonderful, wonderful to see your work continue to develop. I would like to now introduce Dr. Mohammed Jaweed. My interest in global neurosurgery is I'm a vascular surgeon, like many of you, and sort of very, very focused. It's my interest in this is because I am from Afghanistan, and I've always thought about it ever since I was a child, having had to leave and be displaced from my home, and have always been a part of my identity, a part of my compassion, a part of my feelings, a part of who I am. And Joed is a neurosurgeon in Malaysia who went through the similar stories did uh, in Malaysia, practiced neurosurgeon. Um, just said something earlier that really, really resonated with me, and that is to say that when your intentions are clear, when you're trying to do things for the right reason, which is uh, sort of a way Muslims sort of say, good things will come to you. Good things and the right things will come to you. And Joed is that. He's an angel that came into my life. And we've done some beautiful work together. He's right now in Afghanistan. He flew in a few days ago. He's assembling the first Afghan Neurosurgical Society conference. He was supposed to be there with an Italian team and Professor Servade and Professor Khan. So he is the guy doing the work, and he is a charismatic, intelligent, driven human being that just does amazing, amazing work and does it. That doesn't just talk about it. So my brother, please take the stage from challenges to solutions in Afghanistan.
Thank you, Ali. Thank you very much. I hope my voice is very clear because I'm talking from the middle of mountain. Actually, now I'm sitting in my Afghan like costumes, and I just get the rooms and I provide the internet. And thank you for this opportunity to give it to me. I'm getting a little bit shift gears from cerebrovascular. It's almost similar to thing. I think the concept is the same. The challenges, cerebrovascular also have a lot of challenges. I'll get it into the challenges from to have it. I mean, all these least developed countries and challenges beyond that how much we can go and help them out. So currently I'm in Afghanistan, Kabul, and basically tomorrow we're going to have the first neurotrauma symposium. I'll invite all of you to come and we'll have it. So basically the topic I given to you, the solution and the challenges. So in spite of the fact Afghanistan is one of those countries been involved for the past 40 years in war, there's plenty of challenges, but the people still resilient here. And I'll just get the very fat kind of challenges that we have here. And this challenges, basically I put it in term of basically team building and networking, challenging in terms of capacity buildings, medical educations, challenging in terms of instrument consumable in this country. And the fourth one is mentor and mentorships. And the fifth one is role of women. Actually, this is where the pillars and not particular neurosurgery, I will put it in healthcare, which we have it currently in Afghanistan. Actually, we are facing it now. So basically, I'm not going to talk about challenges, but I'm giving a little bit of solution as well. So if you look into Afghanistan, it's a landlocked countries. In the middle of the thing is landlocked countries with 33, officially 36.2 million, but unofficially 32 millions. The GDP, gross domestic product of Afghanistan is 17.3 billions. Actually, it's a little bit improved from the one I did a similar talk in Boston in 2022. Basically, it's improved from those, according to World Bank, about 600 per capita. And the health and education, this is one of those two sectors, actually, I can see it being the most affected part in this countries, in spite of the fact billions of dollars because of this international community was here, was spent in this country. It's almost like $2 trillion spent, but still it's remaining the same. Well, the withdrawal of international communities, I will say that those who was here in 2021, they left Afghanistan's behind. It's almost not if 100,000 of health professional doctors was there. They evacuated. Not only they went themselves, but they take them all this very good people, excellent people with them, and the huge brain drain was there. So there's isolation in terms of diplomatic. Afghanistan have challenges in diplomatic ways. They're not getting recognitions right now, and there's a lot of hassles for us as the professionals to mobilize the youngsters to go for some short term of trainings, fellowships, and courses to go on. It's very difficult for them, and difficult as well being faced in terms of equipment. Prof. Ali is knows better than anyone else, like how much difficulty we have if we bring the equipment to the centers that we require to save someone's life. It's a lot of challenges we're facing, and as well as if you look into the female in this sector is also significantly the role of female doctors dropped. So most of them evacuated. The university is now closed. So all of these challenges basically we're putting it together, and we're looking for them to find a solution. So as usual, I'm having a travels. This is a little of my story. Start from the Kenya, and subsequently from Kenya, I just shifted my goals toward to Afghanistan. So I do have like today's, like it was 2 days ago, I had a field trips to one of the Italians non-organization NGOs called Emergency Hospital. I just visited them up, and we had a good kind of communications. They are a trauma center there, almost being in Afghanistan for the past 21 years. And their lack of neurosurgeons, but we're going to find a way to bring a neurosurgeon to them. So this is one of those hospitals I visit back in the past, and basically there's a lot of huge challenges. Now, last time was challenges from equipment, now from the manpower as well. There's a lot of challenges. So we do have a lot of basically communication among the surgeons, doctors, and providing for them as a webinar, seminars. And as well as we're getting engaged officials, Afghan officials like ministers, Minister of Health, Minister of Education. And because I think it's make easier for us when we send the equipment to the country, basically go. The challenge, number 2, I can call it the capacity building in medical education. So what we thought, the COVID, when they hit, I think it's make a scar, but it's bring a lot of good fortune for us. So they connect to us. They connect us with the community that we can do more better. So what we have done is basically we just like go and give a talk and things. This was the one I went, like there was women was allowed to come to the universities, but now unfortunately they are not coming, females especially. So give a couple of talks to those universities. So what the internet and the COVID did, basically now we're connecting with 5 to 6 centers in Afghanistan. In those centers in the provinces in the middle of the mountain, we bring them up, and we upgrading, and we have different kind of board meetings, tumor board meetings, research and statistics, and medical education, how to write the publications. So we do have alternative week, each week on Sunday, 11:30, we do have this kind of meetings. And most of our fellows, colleagues from all around Afghanistan, we provide for them high band internets. Like currently I'm talking from Afghanistan. I think the internet is quite good enough for them. So we bring external speakers to come and talk with them. So actually we can see now the things running really well, and it's progressed really well on the right directions. So we published a couple of papers about Afghanistan, which in the past was writing by the international communities. It was mostly American when they were here, but now we take the hand in our hands and we're just writing down. So I think this part of the story is very important and very interesting for me, I think, which we change a lot. So they call it mentorships. What we have observed first is with this kind of programs, what we have done is basically we train the surgeons, not only the neurosurgeons, we train the general surgeons to do the life-saving surgery in the provinces. So we have a lot of seminars for them, but with the help of basically This was one of the cases when I was there initially on WhatsApps. They have referred me a case with a really bifrontal contusion, and this patient need the bifrontal craniectomy. What they have sent me, they put the isolate of the bone and they send it to me like that. I said, "Have you done it?" They said, "Yes." So back and forth, we have to draw pictures and send them. And finally, that was the right sides. We have taken out this isolate of the bone because they were not very used to this. General surgeon was not used to. They're afraid of suprasurgical sinus. They might heat it up. So things get better. So what we did, we went one step ahead, and this was one child. We operate through online. So what we have done with this one is this is a posterior fossa tumor, very complex tumor. And the surgeon was there. I just used again some of the basically the gadget application we had, and we operate this child. It was huge tumor. We just like if not 100%, we take out the tumor, 90% of the tumor out. We save the eyes, the hydrocephalus, and everything. The child was in stable location, and this is a fantastic team I'm working with, which is Prof. Ali's one of those really the pillar. I think the strong pillar behind us. I think the guidance of him is fantastic to take us all around to go and do. So after that, what's happening? A magic happened in our things. We come across to get this surgical glasses. This is called smart glasses. It's called Ohana One surgical glasses. It's come into the pictures. So we got a couple of these glasses to the countries, and I went there. I just get some training, and I trained the other doctors. So basically, I want to show you one of those cases that I have done with them. This was a 44 years old females from Nangarhar province. Nangarhar is its regional hospitals covering 5 million population in the middle of the mountain in eastern Afghanistan. And mainly this ladies complain of severe upper back pains and difficulties in walking with the breast reflexes and positive clonus. If you look in the MRI of this one, it's got around C4, C5, 6. It's huge. Lesion is there, and that was a pre-operative kind of things. So it's got a very good reflexes and in clonus. We have it. And this was pre-operatively. She came to the hospital. Basically, it looked very myelopathic kind of gaits, and walked, even she could not walk. So with the help of surgical glasses, this Ohana One, what we have done is, I just put the whole thing. This is the view. Basically, I was sitting in Malaysia, the doctor sitting in the Nangarhar hospitals, and we get the same case, the one I showed to you. We operate together, and this is the case. Basically, we have done the case. Okay. And it's so amazing to me as I think the view was so magnificent. Actually, I had that kind of view. So the control of the glass in my hand, I can zoom in, zoom out the glasses. I can zoom in, zoom out the glasses. I can pinpoint basically where to go, how to operate. You have to avoid these things. This was between C5 and C4. I think it's a dumbbell tumor. I think schwannoma, one of the schwannomas, they come from root of C4 coming invaded inside. So we went and just like safely, basically, we just take out this whole lesions. We take it out safely. And I was having this kind of magnificent, good, clear, and high pixels view while I'm sitting in Malaysia and someone is operating in the middle of the mountain in Jalalabad. So in the past, I would have to say that in the past, basically, we're using drone I mean, in technology to destroy the house, but the same technology we're using to save life and bring some changes to people's life. So we have taken the tumor out. The tumor is totally out, and we brought this things. This lady, she came after she came 15 days post-op to the surgical clinic, and see the same ladies come after 15 days again without infection, and she can walk. And she's happy, and she's doing beautifully. She did fantastic. So I think we have done almost this is almost our 9 or 10 cases. We have done different kind of cases. That was a sample I put it out. In terms of consumable and instrument, we do have challenges. We send the first batch of instrument we sent to Afghanistan. But I think there's a lot of more needs to come, and we do have a lot of challenges. Most of our equipment not reaching there, so we find the channels to get equipment to the hospitals while they operate, because mostly, even till now, they're operating with a Hudson brace. Of course, I mean, challenges in for female, I don't have solution for that yet. Hopefully one day, I think there'll be a solution. We can, a lot of female like Majuba right now, I was so inspired. I mean, the way you give a talk, it was one of the idol to have similar females in neurosurgery to come and help their people. So in conclusion, basically, in spite of all these challenges, of course, we are committed to the field to find the solutions. And we need more basically engagement of our colleagues and officials, develop a good way to communicate with our internationals, basically communities, and find a way to bring the experts on the field to give more trainings on the field. It's mean that not they getting out of the country, the expert come inside Afghanistan to train them. And we have to use the maximal use of digital health platform. I think this is the future, include of AI and all the smart glasses. I think we can do the best. And that was a little bit things I had with you guys to share. And thank you very much for listening. If you have any question, I'm more than happy. And this car is actually made in Afghanistan. Despite if it's, I don't know, indeed, it's running how fast running, it's looking really good. If you bring put together, you can develop so much things. That's really made in Afghanistan. Thank you.
Yeah. A lot of special things and special people are made in Afghanistan. Thank you for an amazing and inspirational talk. It was really, really nice. I think the concept of using technology to go across distance, to go across challenges, to go across politics. Politicians and policymakers and sometimes split people. The point of a doctor is to heal, and sometimes you heal a patient, and sometimes you heal a group of people, and sometimes you help bring a component of healing to a beautiful, beautiful country. God bless you for all the work you do. I am behind you. We are behind you 100%, always. So thank you for this. I wanted to touch on one particular topic, which is very, very sensitive, and that is the education of women. And I know that you're in Afghanistan right now, and I just wanted to put two sides to this conversation. And one is in a country that is women's education is paramount to everything that we do, without question. My mother was a MD, PhD doctor. Afghan women are the strongest women that I've seen around. For the international community, this almost seems as a single narrative that if this isn't happening, this is all the sanctions we're going to do, and this is all the things that we're going to do as a result of this. And the unfortunate component of it is that it these sanctions hurt the exact people and their children that they're trying to help. These sanctions don't necessarily change political decisions early on, but they do make the poor suffer. They make the children suffer. They make the women suffer. They make the poor suffer. That's one component of it. The other component of it is that after 40 years of war, Afghanistan is a hospitable, kind place, deeply rooted in our religion and our culture and welcoming and kind like you. After 40 years of war, things are destroyed, and now you're blaming the cough for the pneumonia that was over there, right? But there is hope. You say challenges. I just learned to stop saying challenges and say opportunities, right? Time changes. People develop. The younger generation goes up. Peace, food, healthcare, the calm calm people that are well fed, sheltered, don't have bombs dropping on top of them, uh, will change and will improve. It's not quick, but it will happen. So I'm sorry for going off on a tangent. I just wanted to get your brief outlook on the future of our country.
Yeah, yeah. Like Alijan, I'm here. I think we have like one of the top smartest people. They're very, very committed. I think what they need is basically, I think they need the opportunity. I think that's been taken for them. I think now they being close things. So we take. As you say, the opportunities. I would not say that the challenges. We take these things to bring it up. I think it's needed time. I think slowly, which we start this program with them, is I think it's coming up, and now we do a lot of those cases not in the past been done here, in terms of neurosurgery, particularly to say we can do it, and those kind of cases been done. So the next thing is we're looking for cerebrovascular. Actually, Afghanistan don't have cerebrovascular in pediatric neurosurgeries. I think we're thinking to look like what Majuba says. The neurosurgeon come to neurointerventions, neurocerebrovasculars. We train them and send them back here to serve the people. So this is the direction we're going, and we are committed to it. And I'm very, very kind of optimistic for that's going to be happen, because the people are resilient and they're open to it, and we're going to get it done. Yeah.
Wonderful. Thank you. Any other thoughts, Giuseppe? Anybody else?
No, I just like to say that I'm inspired by what I've heard and in these two talks, and I would like to know what we can do together to help colleagues who are working in this environment. And the work that has been done in the cases that you show, that's just they're just remarkable.
Yeah. Yeah, true. I think what we need is, I think now the world is coming very closer to closer. I do using these glasses, actually the pixel of these glasses and the view, we see that it's looking amazingly, feeling like you being just stood at the side of them. So I think there's no more anymore needs to come and just go there. I think we have to put the technology together to get into that, and we're getting further more training. So I think we're looking to that directions, and especially in field of neurointervention, which Prof. Ali has the concepts. I think we can do far. Far away, basically can manage the cases. It can be done if you train, and especially in cerebrovasculars. Actually, Afghanistan have a great need in cerebrovasculars. There's a lack of cerebrovascular surgeons, interventionists, and neurologists. I think this is basically the objective of us to get all those fields, like which is till now being here is mostly they've been doing a lot of neuro traumas instead of to be much more specialized field.
Yeah, I think this is a perfect opportunity to transition to the next speaker, Dr. Kevin Wade.